The flight phase begins immediately after extension of the glenoid-humeral joint. The learner must quickly flex the glenoid-humeral joint to 180 degrees by activating anterior deltoid, clavicular head pectoralis major, and coracobrachialis. The torque produced in the lower limbs during the takeoff phase must generate enough force to project the learner off the ground and into the air during the flight phase. As the upper limbs flex, it allows momentum to take them higher. This is when the visual sense of spotting something higher than their eyes at standing level comes into play. After the learner begins to take flight, they must slightly throw their head back. This is done by activating erector spinae, allowing extension in the cervical spine, so their learner can see the visual spot of the ceiling that they originally imaged in the pre-takeoff phase. By doing this while they jump and raise their arms, it causes their center of gravity to raise up as well. When the learner begins to see the ceiling, they use rectus abdominis, internal obliques, external obliques, iliacus, psoas, rectus femoris, biceps femoris, semitendinosus, and semimembranosus to flex both hips and knees, bringing them in towards the center. This causes rotation, and while the learner is tucking their legs in, the glenoid-humeral joint is still flexed, allowing them to grab the posterior distal femur or on their anterior proximal tibia, thus creating the tuck position.